A lot going on today with vaccine boosters. Here are 3 things you need to know. Number 1, starting today, Houston Methodist Hospital and Memorial Hermann are offering boosters to some people in Houston. Millions of Americans who got the Pfizer vaccine are now eligible to get a booster dose 6 months after their first 2 doses. Number 2, vaccine boosters could rake in billions for drug makers. A Morningstar analyst is predicting that booster shots will bring in about $26 billion in sales for Pfizer next year and around $14 billion for Moderna. And number 3, President Biden rolling up a shirt sleeve to get a booster shot today. He says booster shots matter, but the most important thing to do is to get more people vaccinated. A big question you might have is, who is eligible for the COVID booster shot? Evan Kozlov verifies.
A major announcement from the CDC. Booster shots are now approved for millions of Americans. So let's verify some of the details so that we can be sure that we're sticking to the facts. Here are our sources: the CDC, the FDA, William Schaffner from Vanderbilt University, and Amesh Adalja from Johns Hopkins. Let's start by talking about who's eligible. We can verify that according to the CDC, those over 65 should now get a 3rd dose of the Pfizer shot, so long as it's been 6 months since they first got vaccinated. Same goes for those receiving long-term care and those 50 to 64 who have an underlying condition such as diabetes, obesity, or heart disease. As for those 18 to 49, the CDC says that they may now get the booster if they have an underlying condition, but they're recommended to talk to their doctor first.
This is more commonly referred to in medical language as shared decision-making, where you speak to your physician and say, should I get this booster? Should I not get this booster?
Next, let's verify if you could get a booster if you work or live in a place where the risk for COVID is high, a so-called occupational or institutional environment. For example, healthcare workers or teachers. Initially, the answer was no. The CDC's advisory committee voted against recommending boosters for these people, but that was reversed by CDC Director Rochelle Walensky.
Anyone who works in an occupational or is housed in an institutional setting where there's the potential for high transmission, they also would be eligible for a booster.
So verified, yes, you could get a booster after 6 months if you work in one of those environments. Lastly, let's verify. What does this mean for those of us who got Moderna or Johnson & Johnson? Are you recommended to get a booster shot at this point? Our experts say that the answer is no. That's because no Moderna or J&J boosters have been approved, and it's not recommended to mix and match.
The official recommendation is not yet. Please be patient.
With your Verify, I'm Evan Kozlov.
All right, there you have it. Now, do you have something you want our Verify team to check out? Send an email to verify@khou.com. You can also reach us on Facebook and Twitter.